so this is my 2-month update. I am at exactly 8 weeks out of surgery for ACL reconstruction and medial and lateral meniscus repair. All the clips you just saw are some bits and pieces from the last few weeks. So I had my appointment with my doctor today. I'm just going to describe a little bit about where I am now, what the doctor said, and looking forward for the next 4 weeks, what the plan is. First, I'm going to talk about swelling. I feel like I'm still experiencing a decent bit of swelling, especially when I walk or if I'm up for a bit. It still gets pretty swollen, and that's when it starts to get irritated. To manage that, I wear a compression sleeve a lot of the time. As for scarring, my scars are healing up decently well. The ones for my meniscus are healing really well. My one where they took out my patellar tendon to use for my ACL, that is the problem scar, which I have to do a little bit more work on. To deal with my scars, I'm just massaging every day, as well as within my knee to break up scar tissue inside of my knee. And a big thing now that it's summer is I want to make sure to keep them covered when I'm outside. In terms of pain, I don't get too much like sharp pain, but I would say I'm in pretty much constant discomfort. And I think that has to do with the range of motion, which I'll touch on, but walking gets quickly uncomfortable and very tiring for my knee. After my workouts, I have to really just sit down for a while and relax. My knee just gets really irritated, and definitely when I wake up, it's so stiff in the morning, so it's really pretty painful when I wake up. Scar tissue, I'm having kind of an issue with. I think that's blocking like my range of motion. So like I said, I've been massaging. My physical therapist does patellar mobilizations and tries to work on the scar tissue, but it's just a little bit of a challenge. As for strengthening, I feel like I'm doing a pretty good job. Strengthening has not been an issue for me. I feel like it's pretty easy for me to keep progressing. The thing is, I think my range of motion is somewhat inhibiting my strengthening. I am resting at around 5 degrees from extension and around 120 for flexion. After it's warmed up and worked on, I can get to 0 and like 125, but I can't really keep that range. Not having full extension like past to 0 like my other leg has made the walking difficult and painful, and has also kind of inhibited some progression with the strengthening because I can't get my full range, so it's hard to add certain things in. As for my appointment today, she said some of the things I'm experiencing, like the swelling is normal. She was pleased with like the work I'm doing on my knee. I told her how my kneecap will shift when I'm doing squats. I can like feel it moving. She said that's also normal, to try to do different strengthening that doesn't give that feeling. She just kind of reminded me like all the work that was done with repairing both meniscus, which I knew, but I felt like they were still expecting me to be on a normal ACL schedule. But she felt that at this time I can keep really just trying to work through it with my physical therapist and with what I'm doing. So I will go back in another 4 weeks to see the surgeon, and at that time she said if it still seems like there's a lot of difficulty, then they will do an MRI to see how much scar tissue there is. So basically, for the next month, I am still really working on range of motion, really try to get it straight, and she recommended doing it for a longer period of time with like lower intensity. I'm just a little frustrated because I feel like I have been really focusing on that and pushing for that, and it's just not coming, so I'm not really sure anything else I can do differently or on top to break up that scar tissue and really get that range. That is pretty much the update for month 2. I will do a similar format where I kind of film throughout the next month and add those clips in, and then I will sit down and give another update at month 3. Well, thank you for watching, and if you're dealing with your own injury, I wish you the best. I will see you guys in my next video. Bye.